In this video, let us discuss about B12 deficiency, which we come across in clinical practice a lot. So let's look at where the vitamin B12 is absorbed in the body. The body absorbs B12 in a two-step process. First, the acid in the stomach breaks the protein that is binding to B12 and releases B12, and then the B12 gets attached to a protein called intrinsic factor in the stomach, and then together the combination of the B12 and intrinsic factor gets absorbed from the small bowel. So what are the causes of B12 deficiency? Number one, as discussed, gastric problems, for example bariatric surgery. The food is not exposed to acid, which is required for the B12 to be released from the protein that is attached. Number two, atrophic gastritis from autoimmune disease or pernicious anemia. And so because of this, there's no intrinsic factor attaching to B12, which is necessary for absorption. And since the B12 is absorbed from the small bowel diseases such as malabsorption syndrome, Crohn's disease, celiac disease, small bowel resection can lead to malabsorption of B12 and leading to B12 deficiency. In addition, there are some drugs that block absorption of B12, such as metformin, proton pump inhibitors, which are the antacid pills, which are commonly used in the clinical practice, especially in the vegetarians or vegans when they take a B12 poor diet, because most of the vegetarian stuff does not have B12, and so people who are on this kind of a diet will require B12 supplements routinely. So what happens when you have B12 deficiency? Typically, the body can store about 1,000 times B12 that is required daily. So basically, because of this reason, even if you stop taking B12 completely, it takes years for the B12 deficiency to develop. Some of the complications from B12 deficiency include anemia. People develop anemia, and you see that in this anemia, the size of the cells are bigger. Then you see B12 deficiency anemia very often in clinical practice. People have low blood counts. They have symptoms such as fatigue and weakness secondary to anemia. Some people develop what is called neuropathy, which causes tingling, numbness in the hands and feet. B12 deficiency can also affect spinal cord in severe cases, leading to paralysis. In some patients have memory loss. Some in advanced cases, some people have dementia. So how do we evaluate for B12 deficiency anemia? We obtain a blood test, like a blood count, including blood smear. Typically, the blood count will show the size of the cells are bigger, what we call high MCV. Patients have low B12 levels. And there's also another test we do for B12 deficiency, which is called methylmalonic acid. The methylmalonic acid levels are high in B12 deficiency. In addition, there's high homocysteine levels which occur in B12 deficiency. What is the normal B12? Anything more than 400 to 500 is considered normal. So even though if the levels are between 200 to 400 is considered borderline, technically normal, but we consider that as B12 deficiency and recommend B12 supplements. So the goal is to keep the B12 above 400 or 500 if possible. Less than 200 is clearly considered deficient in B12. In those patients, we recommend B12 supplements. Typically, 1,000 micrograms of B12 we recommend daily for 7 days, followed by once a week for 4 weeks, and then after that we typically do once a month. Especially we do that in severe cases of B12 deficiency. Some patients may prefer to take it by mouth, but if they have gastritis or pernicious anemia, then oral supplements may not get absorbed. We then recommend sublingual B12 supplements, which can be used in place of injections. So in summary, B12 deficiency can cause hematological problems, especially anemia. It can also lead to neurological problems such as neuropathy or dementia. So maintaining normal B12 is very necessary. And then B12 deficiency can easily be corrected with sublingual B12 or oral B12 supplements or injectable B12 depending on their particular situations. Thank you for watching this.